Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas. In today's class I am going to explain the histological slides of gastrointestinal system and renal system for your exam. So let's start. This is the first slide and the slide is taken that of the lip. Here you can see. So different points to identify in this slide are: first you can see this is the epithelium. Also again on this side you can see this one is the epithelium, and over here you can also see that this is the epithelium. Just a minute. So this one is epithelium. So first point you have to remember that this lip is lined by the stratified squamous epithelium. On one side the mucus, on one side the true skin is present. In the middle you can see the red area, and on the other side you can see the mucous membrane. In the core you can see the skeletal muscles which are present over here. On the mucous side you can appreciate these are the mucous acini which are present, and on cutaneous area you can appreciate different hair follicles along with the sebaceous gland. So this is the cutaneous area where it is lined with stratified squamous keratinized epithelium. This one is the red area where the non-keratinized epithelium is present, and this one is the mucous membrane. Another slide of the lip. Here you can see again this is the site of the mucous membrane, and this one is the cutaneous area. Here you can see a little bit higher magnification. Here you can appreciate the hair follicles which are present over here, and in association the sebaceous glands are also present. This one is the core of the lip which is formed by the skeletal muscle, that is orbicularis oris muscle. Another slide you can see the cutaneous area, the skin to skin, and here you can see the skeletal muscles, the mucous acini which are present, sebaceous glands which are present, hair follicles which are present. So this is the slide from the tongue. First you should know what are the different points, how you can identify the tongue. So to identify the tongue, first you should know that this is the epithelium. Here you can see this is the epithelium. So on ventral aspect, this epithelium is modified to form the different papillas over here. So here you can see these are the different papillas which are present on the surface of the tongue. Here this area is the core of the tongue, and in this core you can see different skeletal muscles are present. And another important point to identify the slide as the skeletal muscles are present in three different directions. So in three different dimensions they are present. So you can see the longitudinal as well as cross section of the skeletal muscle. So for identification point of view, first this area, these are the papilla, and the different types of the papilla which are present in the tongue. So these finger shaped papilla which are present in the tongue, these are the foliate papilla. This area is the area of the keratinized epithelium which is present on under surface of the tongue. Here you can see the different glands which are present over here. Also in this location you can see, and these are the different sections of the skeletal muscles which are present. So this is the slide of the tongue. You should write as the slide of the tongue with the identification points having the foliate papilla and the skeletal muscle running in all the three directions. This is the same slide at higher magnification. Here you can see the foliate papillas. These foliate papillas are finger-shaped papillas, and they are having the taste buds. So here you can appreciate the taste buds which are also present in it. These are the different portions of the glands which are present in association to the foliate papilla, and these are the section of the skeletal muscles. Another slide of the tongue. Here you can see that this is the epithelium of the tongue, and here you can see the different follicles which are present. Just a minute, I will change the color now. So here you can see different hair follicles which are present, lymphatic follicles which are present over here. So these lymphatic follicles, they show that these lymphatic follicles are present. Beneath these lymphatic follicles you can see large number of the mucus acini as well. So this is basically the slide of the tongue taking from the area of the lingual tonsils. Another slide of the tongue, same slide at higher magnification. Here you can see the papilla which are present. These are the large fungiform papilla which are present, and in the core you can see large number of the lymphoid follicle. So again the same slide taken at the higher magnification. Another slide of the tongue taken from the area of the undersurface of the tongue. Here you can see, so this is the epithelium. So this area is the epithelium. Here you can appreciate this is the epithelium. Just beneath the epithelium you can see this area is the small amount of the connective tissue which is present over here, and then these whole areas are the this is the on this all one is the skeletal muscles which are present in the tongue. So under surface of the tongue there are no papilla, only stratified squamous non-keratinized type of epithelium is present. Beneath the epithelium there is small amount of the connective tissue. Then the skeletal muscles are present in different directions. So this is again another slide of the tongue. So this is another slide for the tongue, and here you can see the different papillas which are present over here. These are basically the filiform papilla having keratin over here. Just beneath papilla you can see small amount of connective tissue, and then these are the different skeletal muscles which are running in different directions. In same slide with another view, here you can see large number of the filiform papilla which are present, which are lined with the stratified squamous keratinized epithelium. Beneath the epithelium you can see small amount of connective tissue, and then the skeletal muscles. Here you can see the another slide with the Mason's trichrome stain, and here also you can see the different papillas which are present over here. Again these are keratinized because you can appreciate the keratin which is present over here. Beneath epithelium in blue color you can see this one is the connective tissue. Here you can appreciate the mucus acini which are present, and these one are the skeletal muscles. So dear student, this is another slide for the tongue. An important point you should remember over here that this one is the circumvallate papilla which is present. Also this one is another circumvallate papilla, and this one is the another circumvallate papilla. So in the circumvallate papilla you can appreciate over here that there are the large number of the taste buds which are present in this location. Also in this area also you can appreciate large number of the taste buds. Also over here just a minute, over here also you can appreciate large number of the taste bud. So this one is the slide of the tongue with the circumvallate papilla. Beneath papilla you can appreciate connective tissue, then the mucus acini which are present over here, and then the skeletal muscle. So you have to write the slide of the tongue having the circumvallate papilla. This is another slide of the tongue taking from the core of the tongue, and in which you can see large number of the skeletal muscles. So these are running in different direction, and these directions are at right angle to each other. In addition to these skeletal muscle, here you can also appreciate the mucus acini which are present. These are the unnamed salivary glands which are present in the substance of the tongue. Another slide here you can see this is the esophagus. So you have to identify the esophagus. So first you should know that this one is the epithelium. Here you can see, just a minute, this one is the epithelium. Then beneath the epithelium you can see over here this is the connective tissue. Then another important point that this area which is empty space, this is actually the artifact which is present, which is formed during the process of the slide formation. And then you can appreciate over here these are the skeletal muscles which are present. So having these all points in mind, you should know first this is the epithelium. Looking at the slide, you can appreciate easily that this epithelium is stratified. Also it is non-keratinized. So when we will go at higher magnification, you will be able to see that this is the non-keratinized epithelium. Below the epithelium you can see the lamina propria which is present, and then the skeletal muscles forming the two muscle cord, the one cord inner circular and outer longitudinal. So this is the slide taken from the upper part of the esophagus. This is another slide, and in this area also you can appreciate over here that first you can see that this is the area of the epithelium. Then you can see beneath the epithelium, you can see over here this area, this one is the connective tissue which is present, and then just beneath this area you can see these all are the inner circular cord and outer longitudinal cord of the skeletal muscle. So having these points in mind, first stratified squamous non-keratinized epithelium, second skeletal muscles which are forming the two bundles, inner circular and outer longitudinal, so you can identify the slide of the esophagus as well. This is another slide of the esophagus. Here you can appreciate the epithelium, then the connective tissue, and then the skeletal muscles. So this is the slide of the stomach, and in this slide, this is a slide taken at a lower magnification. So first point you should know about this slide, that this one is the mucosa. From here, this level, from here to this level, this is the mucosa. So out of this mucosa, important point you should know that the epithelium of the stomach is forming the pits. So here you can appreciate the depth of the pits. Just a minute, dear students. So this is the these are the pits. Here you can see this one is these are the smaller pits which are present, and the depth of the pit is very short. So this is a point at this stage when you are looking the mucosa, and you are looking at that this mucosa is thrown into fold forming the pits, and large number of the glands are present. Just beneath mucosa you can see over here in this area. In this area you can see large number of this connective tissue which is forming the some mucosa over here, and then the muscularis which is present. So this is the slide of the stomach, and looking at the depth of the pit you can identify that this is maybe the slide of the fundus. Another point about the identification of the slide of the fundus is presence of the parietal cells which are present in the basis of the glands. So at low magnification you are unable to see the parietal cells. To identify the parietal cells we have to move on to the higher magnification. So this is the slide at higher magnification of the fundus of the stomach, and over here you can see this area is the total thickness of the stomach. Sorry, this is the total thickness of the mucosa, and this area, if you can see over here, just a minute, these are the line where you can appreciate that this is the depth of the pits which are present over here. Another important point is that in the bases of the gland you can at this level you can see multiple glands which are present, and dark eosinophilia in these glands. These are the multiple glands which are present, and dark eosinophilia at this level show the large number of the parietal cells which are present. Beneath the epithelium you can appreciate the lamina propria which is present over here. So this is the same slide at higher magnification. Here you can appreciate the depth of the gastric pits which are present. Also you can see the surface of the epithelium is formed by the cells having the mucus cup in it. From here to this area, this is the whole thickness of the mucosa, and the level of the pit is nearly 1/4 that of the whole thickness of the mucosa. Another important point, you can appreciate different large parietal cells which are present in it. So this is the slide of the fundus of the stomach. Another slide for the fundus of the stomach. Here you can see, so from this point to this point, this is the thickness of the mucosa. This one is the muscularis mucosae which is present, and beneath it is the submucosa. So these cells, they are lined by the these cells are lined by the simple columnar epithelium with large number of the mucous acini, and in depth you can see the parietal cell as well. So depth of the pits is very short. It is nearly 1/4 to total depth of the mucosa. So this is again fundus of the stomach. Another slide for the fundus of the stomach at lower magnification. Here you can see this is whole thickness of the fundus of the epithelium, and here you can see the level of the pits which are present at this magnification. It is little bit difficult to identify the parietal cell. Beneath the epithelium you can see small amount of lamina propria and then some mucosa which is present, and here you can see the muscularis externa which is formed by the smooth muscles in the stomach. Another slide taken from the pylorus of the stomach. So first important point you should know over here, that this one from here to this area, just a minute, this is the whole thickness of the stomach, whole thickness of the mucosa. Then you can see from this point to this point, this is the thickness of the depth of the pit. This is the thickness of the pit which is present. So this is the whole thickness of the mucosa. This one is the thickness of the pit. Also large number of the mucus cells. Also these mucus cells are present along with the chief cells in the depth of the gland. The pits are deeper. So this is one is the slide of the pylorus. Another beautiful slide of the pylorus of the stomach. From this area to this area you can see this is whole thickness, and this one is the level of the pits. So you can see these pits are even much more deeper at this level, nearly half to 2/3 of the total thickness of the mucosa. All the cells which are present in it are the simple columnar having mucus cup in them. Beneath epithelium you can see the submucosa and muscularis externa. So this is one of the beautiful slide and also an important slide for the exam. This is the slide of the pylorus of the stomach. Same slide at higher magnification you can appreciate. So this one whole thickness of the mucosa. This one is the level of the pit which are much more deeper at this level. Large number of the mucus cups which are present, and also this mucus is present at the surface as well, which is acting as a protective layer for the epithelium of the stomach. So now moving on to the small intestine now. So first important point you should know that in small intestine there are the plici circularis which are present. So these plici circularis are formed by the folds of the mucosa with the core of the submucosa in it. So these are the mucosal folds which are present, and this one is the core of the mucosa. So as you all people know that mucosa is formed by the epithelium, the connective tissue and muscularis mucosa. So here you can very well appreciate that this epithelium is modified and it is forming the villi. These villi are either leaf-like or finger-like villi which are present in the small intestine. In the lamina propria you can see large number of the intestinal glands which are present, and here you can see the boundary line which is formed by the muscularis mucosa. So this one is the submucosa. So now important point, as you know that there are the three different locations for the small intestine. Now first you should identify the site of the small intestine. So how you can identify it? With the help of the plica circularis, with the help of the villi which are present. Also these are the large villi which are present in it. And beneath the epithelium there are large number of the glands. Also the lymphocytes are present. Then muscularis mucosa, and then this is the submucosa. Then what are the different points? How can we identify whether it is a slide of the esophagus? Whether it is a slide of the duodenum, the ileum, or the jejunum. So we will now look at these slides. So another very beautiful slide of the small intestine taken at higher magnification. Here you can see the epithelium forming the villi, and also you can appreciate that this epithelium is simple columnar with a large number of the goblet cells which are present. Beneath epithelium you can see the gastric glands which are present. Then this is the muscularis mucosae, and then this submucosa, and then you can see the muscularis externa which is present. So again, when you are looking at this type of the slide, you are simply supposed to write it as a small intestine. Now this is another important slide, and here you can see a difference. First you should know that this one is the whole thickness of the mucosa, this area. Then you can see that this one is the submucosa, and then you can see that this one is the muscularis externa. So now moving on to the mucosa. Mucosa is thrown into fold to forming the villi. So this is an important point to identify that this is the small intestine. When you can see the villi which are present, the epithelium is simple columnar with large number of the goblet cells, the crypts of the liver con which is present forming the intestinal gland. Then another differentiating point which is present over here, this is the submucosa, and this mucosa contains large number of the mucus acini which are present. So these are basically the Brunner glands which are present in submucosa. And while looking at the Brunner gland, so you can easily write this slide as that of the duodenum. First you have to identify that this is the small intestine. Next point, you should know whether if the Brunner glands are present in submucosa, then you have to write that this is the slide of the duodenum. Another slide over here, you can see this is also another important slide. You can see the villi, simple columnar epithelium with goblet cells, also the intestinal gland, the muscularis mucosae, submucosa, and then the muscularis externa. So this is another slide for small intestine. So this is another important slide. First, you should know that this slide is taken at lower magnification, and second important point, the dark color which you can appreciate in these villi, this is basically a slide taken for the stain of the goblet cell. So with this special stain, the goblet cell stains black. So this black color because of the goblet cells which are present. The typical microvilli are present, and this one whole is the plica circularis which is present. So these points help you to identify that this is the small intestine. Next important point which you should know, that this area, this whole area which is present in the lamina propria, these are the aggregates of the lymphocytes. So these are the aggregates of the lymphocytes which are present in this area, and these are forming the Peyer's patches. So when you will identify the Peyer's patches, you have to write it as the ileum. If you are unable to identify the Peyer's patches, or you are unable to identify the Brunner glands either, so then you can simply write this slide as that of the small intestine. But whenever you are looking either at the Peyer's patches, you have to write ileum, or if you are looking at the Brunner glands which are present in the submucosa, then you have to write it. So this is the same slide at further higher magnification. Here you can appreciate the different villi which are present. These are the surface modification. Also the black color show the goblet cells which are specially stained in this slide. This one is the mucosa, and this is the limit of the lamina propria, and in lamina propria you can see large number of the lymphocytic aggregates which are present. So this is the slide of the ileum. Again the same slide and further higher magnification to show you the lymphatic aggregates over here, and also these are the glands of the ileum which are present in the mucosa. This one is another slide for the small intestine. Now your important point to remember is that this one is the whole thickness of the mucosa. This one is the whole thickness of mucosa, and this is the muscularis mucosae and then submucosa. So the different villi are present in this slide. As you can see easily, the different villi are present. So neither you can appreciate the Brunner glands in the submucosa, nor you can see the Peyer's patches. So you are simply supposed to write it as a slide of the small intestine. This is another very beautiful slide. Here you can see the epithelium, and this epithelium is thrown into fold to form the villi. Lamina propria contains a large number of the connective tissue along with the lymphocytes, and also the Brunner glands which are present over here. And these Brunner glands, even in this slide you can see that they breach the muscularis mucosa and even present in the submucosa as well. So this is the slide of the duodenum. Again, you can see now this is different slide. This is a slide of the large intestine. The point to differentiate it from that of the small intestine is the surface. So you can see over here that this surface is flat over here. There are no villi present at the surface. This surface dips inside to form the intestinal glands. Second important point is a large number of the goblet cells. So number of the goblet cells down the tract increases, and it may be at the end of the large intestine, it may be 2:1 ratio, 2 cells columnar to 1 goblet cell, or either 1:1 ratio may be present. This is the boundary line where the muscularis mucosae is present. This one is the submucosa, and here you can see the muscularis externum. So the large intestine at higher magnification, very beautiful slide, the slide of the exam. Here you can see a clear cut straight line over here. No villi are present. This is a very important point, and this main point help you to identify the slide of the large intestine. Large number of intestinal glands present in the lamina propria. They contain large number of the mucus goblet cells. This one is the submucosa, and then the muscularis externa over here. And also very important point, you should know that the large intestine, whether it is colon, whether it is a rectum, there are no special significant differences between these areas. So you are simply supposed to write it the large intestine. Only the difference is now large number of the goblet cells, which increases down the tract and which is difficult to identify at this level. So you are supposed to write it as a large intestine. Same large intestine at lower magnification. Here you can also appreciate the flat surface of the cells, then the intestinal glands, the muscularis mucosae, and here you can see the submucosa. So this is the folding of the mucosa. These are the hausturations. These are temporary fold which are present over here. This is again the slide of the large intestine. Then another slide for the large intestine. Again you can see the flat surface over here and this whole thickness of the mucosa. The pink color line shows is muscularis mucosa, then this is the submucosa, and here in these areas you can see the muscle coats. This is a beautiful slide for the appendix. I have told you repeatedly in many classes that this is one of the slides in which we can see the whole of the lumen at the low magnification in the slide. This is one of those slides. Then again another point, the epithelium, the mucosa resemble that of the large intestine. So very clear you can see in this location over here that there are no villi, the straight surface is present. Intestinal glands are present, and very important point, very important to memorize, that this contain a large number of the lymphoid follicles. Either they may be primary follicles or the secondary follicle. They are present and they present in the submucosa, and they breach the muscular mucosae and reach up to the level of the lamina propria. So there is no boundary between mucosa and submucosa in case of the appendix. And another important point, that whenever you are looking at the slide of the appendix, first impression you got about this slide is large number of the lymphoid follicles, which gives you appearance that it may be some of the lymphoid organ. So large number of the lymphocytes which are present, complete lumen, the mucosa resemble that of the large intestine. So this is the slide of the appendix. The same slide at higher magnification. Here you can see the mucosa, the intestinal glands, and the secondary follicles and the primary follicles which are present. Another very important slide and very easy slide. This is the slide of the gallbladder. It has mucosa and then there is no submucosa in gallbladder. Directly beneath the lamina propria there are the muscles. Another important point is that mucosa is thrown into fold, and these folds are trapped inside the mucosa, inside the lamina propria, giving a false appearance of a gland, although these are not the gland, these are the folding of the mucosa. So these are called the Rokitansky-Aschoff sinuses. Another important point, tall columnar epithelium is present. So the important point, the tall columnar epithelium, and then the mucosa, and then the muscularis externi. This is one of the beautiful slide of the liver. Here you can see the central vein which is present, the cords of the hepatocytes which are radiating from the central vein towards the periphery, and in this area you can see the portal triad which is present. So this one is the artery, a larger artery. This one is these are the two sections of the veins which are present, and at some location you are able to see the bile duct which is lined by cuboidal epithelium. In this section it is not evident. Another slide, here you can see large number of the serous acini which are present, and in addition to serous acini you can also see the islets of the Langerhans which are present. So these are the islets of the Langerhans which are present, and this is clearly a slide of the pancreas. Then the sublingual gland and submandibular both are the mixed salivary glands, but sublingual gland is the predominantly mucus, contains the mucus acini. If the serous acinas are present, they are present in the form of the tamilunes. So this is the slide which are showing you these are the septas dividing the substance into lobes and lobules. This one is the larger duct which is present in the septa, and these all are the mucus acini. So clearly this is a slide of sublingual gland. Another slide of the sublingual gland at a lower magnification, you can easily identify large number of the mucus acini, and this one is the septa. So this one is another slide of the sublingual gland at the low magnification. Here you can see large number of the mucus acini which are present. These are the septas which are containing the ducts of the sublingual gland. This is a special staining for the sublingual gland. This is Mason trichrome stain, in which you can see large number of the mucus acini in the septas or the ducts. Here you can see a larger duct which is present. The same slide at higher magnification to appreciate the structure of the mucus acini. So here you can see the mucus acini. The nucleus is flattened and it is present at the periphery, and the whole of the cell is filled with the mucus. This one is the slide of the submandibular gland. So just like sublingual, it is also a mixed salivary gland. But important point to remember is that this gland is predominantly serous. So here in this lobule, you can see all of the serous acini are present. In addition, you can also appreciate the striated duct which is present. In this lobule, you can also see all of the serous acini along with the intercalated and the striated duct. And in this area you can appreciate the mucus acini which are present. These are the adipose tissue, so please don't confuse these adipocytes from those of the mucus acini. These are the mucus acini and these one are the adipocytes. So this is the slide of the submandibular gland. So this one is the slide for the submandibular gland, and in this slide you can see large number of the acini which are present. So these are the mucous acini with the serous demilunes or the serous acini themselves. So one of the mixed type of the gland having the mixed acinus. But important point you must remember over here that although both the submandibular and sublingual are mixed salivary glands, but in case of the sublingual, most of the acini are either mixed, or if serous they are present only in the form of the demilunes. So in this slide there are large number of the serous acini as well, which are either solitary acini or in the case of the demilune. So this is one of the mixed salivary gland which is submandibular. This is another H&E stain section of the submandibular gland at lower magnification, and in this you can see in these location large number of the acini which are present in addition to adipose tissue over here, and also the ducts which are present in the septas. Here in this location you can also see a large duct which is present. This one is one of the best slide for the parotid gland. At lower magnification you can appreciate large number of these serous acini which are present, and point to remember is that the serous acini have the rounded nucleus which is present in the center of the cell. So in these all the acini, the nuclei are rounded in shape. In the septa you can appreciate the blood vessels and the ducts which are present. So this is the same slide at higher magnification, in which you can easily appreciate the different acini which are present. These all of them are the serous acini along with the ducts which are present. The smaller ducts are these one are the smaller duct which are the intercalated duct, and these are the larger ducts. This is the slide for the urinary bladder, and in this slide you can see first the epithelium, and this epithelium is transitional epithelium. The surface cell are typically dome shaped cell. Beneath the epithelium you can see small amount of connective tissue, and then the lamina propria which is present over here. And here you can see the smooth muscle. So as the urinary bladder is a globular shaped organ, so the smooth muscle cells are intermingled, although they are present in the three layers, but these three layers are mixed with each other. So this is the slide of the urinary bladder. This is another slide of urinary bladder with Mason trichrome stain, and in this you can see this one is epithelium which is transitional in nature. Just beneath epithelium small amount of the connective tissue, and then a large number of the smooth muscles present. Different sections of smooth muscle are present. Another point to differentiate the urinary bladder from the ureter is that in case of the urinary bladder, usually it's a large organ, so it is difficult to see whole of the lumen of the urinary bladder in one view. Here again another slide of the urinary bladder at higher magnification, and here you can observe the types of the cells which are present. So these are the typical dome shaped cells of the transitional epithelium. Here you can see lamina propria and then the muscularis. This one is the slide of the ureter, and in this slide you can see the star-shaped lumen which is evident. Also the transitional epithelium, the small amount of the connective tissue forming lamina propria, and then the at number 3 you can see the muscular layer which is present, and outer to this is serosa which is present. Here you can see also the adipose tissue. So the identification point here for ureter is first star-shaped lumen, second complete lumen which you can see at 4x power, and third the epithelium which is transitional in nature. So these points help you to identify this slide. Another slide of the ureter at with the H&E stain, and in this stain also you can appreciate the star-shaped lumen, also the transitional epithelium, then the lamina propria, and then the muscularis externi. This is the slide of the kidney at the lower magnification, and in which you can easily identify the different renal corpuscles which are present, and in addition to renal corpuscle, large number of the proximal and the distal convoluted tubules are present. So this is the slide of the kidney. Same slide of the kidney at higher magnification to show you the renal corpuscles over here, and in addition to renal corpuscle in these locations you can also see the distal and the proximal convoluted tubules. The same slide at further higher magnification. Here you can see the renal corpuscle. So this area, the white color area, this is the Bowman capsule. Here in this location you can see the macula densa which is present. These are the section of the proximal convoluted tubule. Their lumen is not clear. They show dark eosinophilia and the cells are larger as compared to the cells of the distal convoluted tubule. These are the smaller cells and they have the less eosinophilic cytoplasm. This one is the distal convoluted tubule and these are the proximal convoluted tubule. Here again in these areas you can see the distal proximal convoluted tubule and this one is the distal convoluted tubule. This is an obliquely cut section of some of the distal descending tubule may be there, and this one is also a collecting duct. So this one is another slide of the kidney at lower magnification, and in this you can appreciate large number of the renal corpuscles which are present. This is the connective tissue septa forming the capsule of the kidney, and this whole area is the renal cortex. So that's all about the today's lecture. Thank you very much for your attention, and Allah Hafiz till the next class.